Good afternoon and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us again today is Margie Propp. Thank you, Margie, and thanks to everyone for joining us. Our local situation is looking even better. This week, the risk dial will be moving from low orange to mid yellow. It's the first time the dial has been in yellow since late October. Our indicators continue to improve, and over the past week, the number of new cases has again declined from 430 the previous week to 264 the week ending February 26. As this chart shows, we've now seen cases decline for 6 consecutive weeks. We also want to show that the decline in new cases is mirrored by the wastewater testing results. On the chart you're seeing now, the blue bars represent the decline in cases, and the trend line represents the decline in the virus detected in wastewater. This is another indicator that confirms the improvements we're experiencing. The positivity rate held steady this past week, ending just slightly higher than the previous week, up from 8.1% to 8.3%. And thankfully, the number of COVID-19 patients hospitalized locally has continued to decrease. This chart shows the decline in the 7-day rolling average of COVID-19 hospitalizations in February from 141 at the beginning of the month to an average of 54 on February 27th, a decline of about 62%. Today, the hospitals are reporting 41 patients, with 26 from Lancaster County. And today, we're very happy that we have no deaths to report. Sadly, we lost 32 members of our community to COVID-19 in February. And you may have already heard about the new community level guidance released by the Centers for Disease Control and Prevention last Friday. The federal agency updated the way it monitors COVID-19's impact on U.S. communities by looking at each county's rate of cases, COVID-19 hospitalizations, and hospital capacity. The updated guidance eases mask restrictions for communities where cases aren't high and hospitals aren't highly stressed. We understand the effort to update the guidance and adapt to changing information and circumstances as well as the latest science, and we will continue to evaluate the metrics used. We have continually adapted our local guidance and prevention measures throughout the pandemic based on our local situation using a data-driven approach. The position of our local risk dial is based on multiple indicators and not just a single measure, as we've reported previously. Our health department wants to continue to ensure that we're clearly communicating the risk of COVID-19 spread and the public health impact to members of our community. To do this, we continue to use the key indicators including positivity rate, case rate, testing, healthcare capacity, vaccinations, and deaths. At this time, we will continue to factor all of these indicators into the risk dial review each week. As we announced earlier, an analysis of our local data for all key indicators resulted in the position of our local risk dial dropping from orange to yellow. This indicates a moderate risk of spread and impact to our community. Almost every single indicator has improved over the past few weeks, as you can see on the slide you're looking at now. No indicators are currently in the red category. 2 indicators are in orange, positivity rate and deaths. 2 indicators are in yellow, case rate and hospitalization, while the other key indicators are in green, vaccination rate and testing turnaround. The position of the dial can be seen in yellow on this color gradient map by the blue square outlined in red. We've revised our public health guidance for yellow, which can be found at covid19.lincoln.ne.gov. For the general public, the guidance no longer recommends mask wearing indoors. However, you should still mask up if you have symptoms of COVID-19, have a positive COVID-19 test, or have been exposed to someone with the virus. In addition, those over age 65 and people with medical conditions associated with higher risk for severe COVID-19 should consult with their healthcare provider about additional protective actions they should take. Many people will choose to continue to wear a mask and we're supportive of that. There are some steps we should all continue to take regardless of the color of the wrist dial. Get vaccinated and boosted. Get tested if you have COVID-19 or flu-like symptoms or have been exposed to someone with the virus. And please stay home if you're sick. These actions help protect us, our families, and community members, including those who may be at higher risk of severe illness. And we wanted to look at our vaccination data and share information with you. More than 66% of all Lancaster County residents are fully vaccinated. Around 60% of residents 12 and up have received a booster or a third dose. And our walk-in vaccination clinics at local elementary schools will continue in March. All clinics offer first and second doses and boosters. This afternoon we'll be at McPhee Elementary from 4 until 6:30 p.m. On Wednesday, we have a clinic at Saratoga Elementary from 3:15 to 6, and a clinic at the Health Department from 4 to 7. And on Friday, our Health Department clinic is open from 9 to 3. You can find more clinic times and locations on our website or by calling us at 402-441-4200. I want to remind everyone that we have at-home tests available at the Health Department in the main lobby during regular business hours. We're located at 3131 O Street. Just walk in and pick one up. We handed out more than 1,200 test kits to the public last week in 3 short days. In closing, we're happy to see sustained improvement in our local situation. At the same time, we're also aware of how quickly our situation can change. The future of this pandemic remains uncertain, but right now we're very encouraged by our progress. And with that, I'll take any questions.
We do have a question from KFOR. Is there any indication that any other COVID-19 variants are spreading toward our area?
I was just on a call with many leaders talking about that and some of our infectious disease consultants this morning, and we're not seeing any right now heading towards our area at this time, but we remain vigilant in watching that, and we certainly will let the public know.
Sure. Pat, have there been any reports of home tests? Excuse me. And have you guys been keeping track of that and have any numbers?
You know, Matt, that's a really great question, and I meant to check on an update of that, but I'll get back to you and tell you.
I'll just ask, are you feeling better at this point this year than you did last year? We've kind of had a similar trajectory. It's a little bit different, obviously, this time because we went up so quick and down so quickly. But are you feeling same, better, worse than at a similar point last year?
You know, at this point last year, we were getting immunization, vaccinations out there, but not as widespread in the community. And we didn't have some of the pharmaceutical interventions that we have now. So I definitely feel much better about where we're at. We have oral antivirals, we have monoclonal antibodies, and we also have vaccinations that have been approved that are safe and effective, and continue to encourage people to get their boosters. We think all of that is making a tremendous difference. So right now I feel greatly encouraged by where we are as a community and where we're moving forward to. It's been great to see the numbers go up and come down and be a little more sustained. We didn't have that impact with Delta. The thought was that it would go up and come down, but what we saw was a sustained infectious period. Okay, all right. Thank you. I appreciate you joining us today, and remember to get vaccinated and get your booster if it's due.